You are watching the DocTalk show.
So, Dr. Grace, you said the kidney helps to filter the blood and the urine, the waste products pass out through urine. Maybe you could just briefly summarize if the kidney is to fail, how would the person feel? How would they present? We talked of reduced urine output, but could there be other signs of kidney failure?
Thank you, Darius. So basically, what the patient, what one will experience, or what the things that we see and we think that someone has kidney disease are things that come about as a result of the kidney failing to do its function. So once the kidneys are not filtering the blood, it means you're retaining the water. And when you retain this water, you start to swell. Because the excess water has to look for where to go, it cannot remain in the blood vessels, so it goes under the skin. So you start swelling on the face, or the legs, the feet and the legs, and eventually the whole body. And two, because you're not passing out this water in urine, then your urine reduces in amount. You may notice that either when you got past urine, you pass very little, or you go less times than you used to go, maybe once a day or not at all, sometimes. Exactly, exactly. And also, like we said, the kidney helps us to make blood. And blood to a human being is like fuel to a car. So when you don't have blood, then you're not going to be able to do anything. Your body does not work well. So you feel tired very easily. Where if you used to run, you now can't run, or you have to stop to catch your breath every so often after a very short distance, or you feel your heart is beating very fast because it is trying to pump that little blood that you have to the rest of the body. So that is another thing that the patient may experience. And then also, because when kidneys fail, they cannot remove the toxins or the wastes. So when these wastes accumulate, they try to look for where to come out from. So you start vomiting. Because they cannot come out in urine, they will start coming out in vomiters. Or they start coming out actually through the skin. So your skin starts itching. So then you may feel you don't have appetite because you feel you want to vomit all the time, so your appetite is low. And actually, eventually, these, when they are not removed, as we shall tell you by treatment, when they accumulate and they are not removed, they start affecting your blood cells and you can easily bleed, or they actually affect your brain and you can become confused, become disoriented, you can become unconscious, and eventually you can actually die.
All that is because of the toxins accumulating in the body.
Accumulating
they
in the
fail
body.
to pass out in the urine.
Yes.
That emphasizes the role of the kidney in helping to filter the blood. It removes these toxic residues so that they don't cause damage to other organs like the brain and the heart. Okay, so Dr. Gavu, these are what they call complications. Kidney disease, almost every disease has problems it brings along with. So what problems does kidney, if the kidney is to stop working, what would go wrong? What would happen? What complications might one experience?
Of note, Darius, these complications actually manifest when someone has lost a very big part of their function. And that's the danger with kidney, or that's the part that makes it tricky. You don't get to see this. You don't get to see this. So by the time we get to see these overt complications, a lot has been lost. And we need to emphasize that we want to catch this as early as possible. Many people want to be assured that they are passing good urine, so the kidneys are working well. Passing urine is only one of the functions. So just watch, and the best way is get screened. Go to your health doctor, let them check and tell you this is fine, this is not fine. So heading to the complications, the kidneys, small as they are, they actually affect every system in the body, from your head to the toe. So the brain, you will be feeling weak, tired, low energy, low drive, sleepy all the time, and the sleep will not be quality time. Because the kidneys are involved in the making of blood, eventually your blood levels go low, and this will manifest as weakness. Someone is not able to dig the way they used to do. Yes, you can't jog the way you used to do. Even simple things like laughing make you so tired, and that weakens your heart. So when your heart now becomes weak, then the swelling actually gets worse. You find trouble lying flat. You need to put something like a pillow, and not just one, two, under your chest and under your head.
Like lying flat,
yes,
like sleeping on the bed.
Exactly, you're not able to lie flat.
So why is that so?
Because when the heart fails, it can't pump the blood from the lungs. So the blood accumulates there.
Okay.
Yes, and so most people would wake up angering for air, and they will go and open the doors, open the windows to try and catch some air. That's the big manifestation.
Given the big magnitude of this problem, the kidney injury, if in the event that the kidney fails, or God forbid, if it is to fail, and the person cannot pass out urine, the person's body is swelling, all the toxins are retained in the body and causing disease, what can be done to save such a person?
We have stages of kidney disease. So when you come today, they may tell you have kidney disease, but when you're actually passing some urine, you're still removing some wastes, you're still making some blood. So depending on the stage of kidney disease, then that gives us how to manage you. But essentially for every patient with kidney disease, if they are not removing the water as they should, then we give them some drugs to help them remove the excess fluid. We give them some medicines to help them form blood. We give them some medicines to help them control their blood pressure. If they are also diabetic, we treat the diabetes because the sugar also continues to affect the kidneys. And then when the kidneys have totally failed, now we have to remove the wastes, and there are two options. So the best option and one that would cure kidney failure is to get a new kidney, and that is what we call kidney transplant. Unfortunately, at the moment, it is not done in Uganda. Patients.
Is it being done in the world?
Yes, it is being done in the world. Patients in Uganda who need to do transplant or who have done transplant, most of them have done it from India. But these treatments are very expensive, as we shall talk about that. Then the other, as you maybe plan to do transplant, we do what we call dialysis. So what is dialysis? Dialysis is actually washing, cleaning of blood. There is a machine called a dialysis machine that does some of the functions of the kidneys, like removing the excess water. So there is an artificial kidney. So what is basically done, we connect tubes on the machine, we connect this artificial kidney, and we put a catheter in the patient, and we remove their blood, some of it, and clean it. So it goes through the machine, it gets cleaned, the excess water is removed, the wastes are removed, the minerals are stabilized, and then it is put back into the person.
Okay, so it's the machine doing the work of the kidney.
Exactly.
But you say it's a very expensive procedure. How much do you think it costs to do this procedure?
So at the moment, the cost is about 700,000 to 3.6 million, depending on where you're doing this from. Because it is being done at Chirud Hospital, at Imbarara Hospital, that's where it costs about 700 because the government has subsidized the fee. But if you go to Nakasero Hospital, Case Hospital, the private hospitals, then it can go up to 3.6 million.
This is like the whole treatment or just per session?
Part of the treatment.
Part of the treatment.
Yes.
Okay, so we'll come back to explain more about the dialysis, how exactly it works, but like the way you're describing, it's a very tedious, a very expensive process for one to undergo. So ultimately, what would save many Ugandans is prevention, and we are going to talk about preventing kidney disease. How do you prevent this condition from progressing to the stage that you need a transplant or that you need dialysis, a very expensive procedure that not many people can afford in this country. So after the break, we shall come and discuss that. Don't go away. You can send in your questions and comments on our social media platforms. That's on Facebook, Twitter, and you can also log on to our YouTube page. That's the DocTalk show, and you can continue watching some of these videos.
You are watching the DocTalk Show.